Before we dive into the ins and outs of underarm hyperpigmentation, let's make one thing clear. Photoshopped ads may have you believe that everyone has clear, smooth, and toned underarms, but the truth is, some people naturally have darker underarms, and that is completely normal. Now more than ever, people are speaking up that perfectly shaven arms and legs is a myth, and it's okay to have some hair or even pigmentation, especially if you belong to skin of color. This is actually a requested video, and I realized that I should have made this sooner given that there is so much misinformation available on this topic especially. This particular thing is not related to underarms per se, but I was actually shocked to see the extent to which people go to lighten dark skin, and they're doing it even for small babies. Let's see the short video together. They use a skin whitening cream and a scrub that's working like magic on a baby. Look at that little one. Scrubbing is an absolute no-no. I don't know where did they get these ideas. Please don't try something like this for yourself, and especially not for children. You will understand why by the end of this video. Coming back to underarms, now I know how conscious people get, especially when their underarms are darker than the rest of their body. Many who come to seek treatment usually come because they feel shy or they're very conscious about how their underarms appear. And I can understand because everyone wants to be able to wear sleeveless shirts, wear their bathing suits in public, or participate in sports. So in this video, we are going to discuss what are the causes of underarm pigmentation. Then we are going to discuss what are the ways you can lighten an existing underarm pigmentation. And finally, we are going to discuss what are the ways to prevent underarm pigmentation if that is something you don't have already. Hello and hi once again. If you're new to the channel, I'm Dr. Sanoba Doctor, fondly known as Mrs. Dr. Doctor. I am a dual board certified dermatologist practicing integrative and holistic dermatology, and here I am your skin and health coach. We discuss everything related to skincare, holistic health, and everything needed to lead a healthy and happy life. So if that is something of interest to you, or if there is something that you want me to cover, don't forget to leave it in the comments below and subscribe to the channel if you haven't already, because that is the only way you and I can stay connected for a very long time together. In this video, I'm hoping to answer most of the doubts that you might have regarding underarm pigmentation, and I'm hoping that by the end of it you will be well aware and be well educated so that you can make a decision on what's happening with your underarms, and so that you can take steps to lighten it or prevent it from darkening in future. So without any further ado, let's begin. First, let's discuss the causes of underarm hyperpigmentation. Hyperpigmentation, that means increase in the pigmentation of the skin in that area. Alright, this could be due to chemical irritants present in deodorants and antiperspirants, irritation and abrasion caused by shaving, the accumulation of dead skin cells due to infrequent exfoliation, friction caused by tight clothes, conditions like melasma, acanthosis nigricans, or due to infections like erythrasma, or because of certain habits like smoking, which increases the chances of hyperpigmentation not only of your underarms but of other areas of the body as well. But if I have to break down and make you understand in a very simple manner as to why underarm hyperpigmentation or why underarm darkening can take place, it can mainly fall into because of physiological causes. That means what can normally occur because of certain evolutionary changes during our life. And the other subgroup are pathological causes. That means there is some factor that is resulting in that increased pigmentation, which we will discuss in some time. But first I want to just set this thing very clear that when I'm speaking about the physiological or the normal causes of underarm darkening, it is very normal during puberty, pregnancy, that certain areas of our body will develop increased pigmentation than the rest of the body. And underarms are especially one area. So the underarms, developing certain pigmentation over the cheeks, in the perioral area, around the nipples, in the groins. These are certain areas where you'll notice as a woman especially that as you undergo these hormonal changes, there can be slightly increased darkening in these areas. But apart from these normal reasons, the main reason why there is increased pigmentation in general can be due to two reasons. Either the melanocytes, these are the cells which are responsible for producing the pigment melanin. I want you to listen to the word again melanocytes, because you're going to hear it very often throughout this video. So these melanocytes are the cells which are responsible for producing the pigment melanin. Alright, and they can get triggered due to various reasons, either due to certain hormonal disturbances or hormonal changes. They can get stimulated because of an infection or any condition that can lead to inflammation. Remember in the entire video series where I teach you how to create your own skincare routine step by step, in the very first step, what did we do? We tried to identify what skin type do we belong to, and that is the basic thing that you need to establish first. Now, if we belong to the skin type, especially from skin type 4 to 6, there is a very high chance of hyperpigmentation following any sort of inflammation. Now, inflammation basically means there's going to be increase in the blood supply and increase in white blood cells and killer cells that are going to come to take care of whatever the problem is in that area. And because of that increased blood supply and increased amount of activity that is occurring between the body and the other foreign substance that is trying to get inside, that is going to stimulate the melanocytes which is present in the basal layer of our skin, and that irritation is going to lead to higher chances of post-inflammatory hyperpigmentation. So you'll very generally hear your dermatologist or your skin colleague tell you PIH, that is post-inflammatory hyperpigmentation. So out of most of the factors that I had enumerated before, the cause of hyperpigmentation will be because of that irritation and stimulation of the melanocytes to produce more melanin. But it is also possible that there could be certain conditions like acanthosis nigricans especially, where the thickness of your skin has increased, and it is believed that that increased darkness that we see in these areas is because of that increased skin thickness per se, and not because the melanocytes are producing more melanin. Now, the reason why I'm discussing this in detail is because when you're trying to treat this with your dermatologist or with your healthcare provider, if we understand what is actually happening at the level of the skin surface, and if we apply certain things or go for certain procedures that is going to take care of that abnormal thing that is happening, we will be able to get more effective results instead of just trying one thing after the other and seeing that nothing is working. So if you're not aware, acanthosis nigricans is actually a very common skin condition which leads to darkening and this very characteristic velvety appearance to the skin. It's very commonly seen over the back, the nape of the neck, the underarms, and even the groins. So when you see this kind of skin, and in general, acanthosis nigricans can occur very rarely in an isolated form, means just on its own, but generally it is a clue to underlying obesity, metabolic disorders, polycystic ovarian syndrome. So if you see this over the skin, then you need to even find out what is the exact cause that has led to your skin to increase the thickness over there, increase the pigmentation over there. Because if you're just going to take care of the skin and not take care of what's happening within the body, you're not going to see effective results. So if I have to quickly summarize or revise with you what could be the cause of that underlying increased pigmentation in the area under your arms especially, it could either be normal, which you have to learn to accept, or it could be due to an underlying condition. Now that could be either because there is an infection or there is some inflammation that is triggering your melanocytes to produce more melanin, or there is thickening of the skin because of various conditions, especially like acanthosis nigricans or eczema or certain conditions where that increased thickening is giving that appearance of darkening. Now that we've understood the why, Let us look at the various ways in which we can take care of it and prevent from underarm darkening to increase and worsen further. Now, I don't know of anyone who roams with a hairy armpit anymore. Like, even men have started keeping that area clean. So if you're used to shaving that area and you and your healthcare provider have ruled out all other causes that we just discussed before that could possibly lead to increase in the underarm pigmentation, then it is worth considering changing to an alternative form of hair care removal like waxing or epilation instead of shaving. Now, there are many reasons for that. The first thing is shaving can increase the chances of ingrown hair. These are small, tiny hair that get trapped in that opening from which the hair actually comes out, and that trapped hair can not only itself appear darker, which can give that illusion of darkened underarms or darkened armpits, but they can also irritate the skin. And remember, any form of irritation will lead to inflammation, will lead to post-inflammatory hyperpigmentation. Then there is also a possibility that the metal that is used in certain razors can have nickel in it. Now, nickel is a very common ingredient that is used in most metallic alloys to produce many things, and nickel allergies are the most common forms of allergies that specially cause contact dermatitis. Alright, so if you are allergic to nickel or any particular thing that is present in the metal, there is a chance that because of that repeated contact with that metal, it is leading to very minor levels of inflammation, which over a period of time is triggering your melanocytes slowly, and that is leading to that overall hyperpigmentation in that area. There is also a possibility that when you shave, it can lead to minor cuts if it is not done in the right direction, and these minor cuts again can lead to inflammation. Remember, especially for us people of skin of color, any scratch, cut, bite, bruise, any simple thing also has the chance of healing with pigmentation. That is why it is so important to take care of it right at the healing stage instead of waiting for the pigmentation to set in, because it is very difficult to get rid of that pigmentation. The second thing that I really want to discuss is stop scrubbing, please, and stop using a physical exfoliator if you are doing so. I know scrubbing the underarm with homemade remedies is all over the internet, but just for that temporary satisfaction that you're going to get, and I call this temporary because when you're actually physically scrubbing, like it's a form of exfoliation, you're going to remove the top dead layer of skin cells, and that is going to give you that lightened, brightened appearance. But that is not going to take care of what's happening below. And instead, what you've done is you have irritated those melanocytes which are present below, and they are going to now produce more melanin in return. And that's why you'll see people who are used to using loofahs and scrubbers and all sorts of things, especially in people of skin of color. I'm again and again repeating this because our skin is very different from fair-skinned individuals. Not that they don't have their own set of problems, but pigmentation is not one of their worries because of that decreased amount of melanin that the skin in general has. Just to explain this and drill this into your head even better, imagine you are sleeping or you're sitting quietly and doing your work, but someone comes and then tries to poke and trouble you. Won't you get agitated? The same is true with our melanocytes. They are doing their job just fine, but you're going over there and trying all sorts of things and scrubbing that area is when they are getting stimulated and producing more pigment. The third thing that I wanted to do is stop using products that have fragrances or even certain natural deodorants if you see it's not working for you. I've had so many people try natural deodorants, especially after they see it being pitched on Shark Tank, and they come up with rash and boils. Now, they used it because obviously they thought it was safe for their skin, it was safe for the environment, and because of that brilliant emotional pitch that they see being televisionized. Now, I'm not saying all of them have the potential to lead to a rash. I want you to read the ingredients, but they don't realize that there are certain ingredients that are being used, especially if you notice sodium bicarbonate as the first ingredient. You should be a little wary of it. It is part of most skincare formulations, but you'll see that down in the ingredient list. It is very alkaline. It is generally used as a stabilizer, and it is a very potent irritant. It does not suit everyone. Yes, there are amazing natural deodorants and antiperspirants available, so you can definitely try them, but please be careful of what's in them before you go about using anything and everything, especially over your underarm. And what I generally recommend before trying any new product, it is a good thing to try it over the inner surface of your arm or over your thigh. Like, do a patch test before you try any new product, especially before applying it over your face or your underarm, because the skin in this area is more sensitive and it is thin. And the reason why the underarm area is a very tricky area is because, number one, it is a skin fold, alright? So anything that you apply over there is going to stay concentrated in that area. There is no chance that it is going to get rubbed off. It's just going to stay over there. And secondly, the temperature of the area in the axilla, that is our underarms, is slightly higher than the rest of the surface of the skin. And this increased temperature can make your skin more sensitive and reactive to ingredients which otherwise would be fine for the rest of your skin. So switch to a clean, fragrance-free deodorant, and I'm not talking about the commercial ones because most of them will have fragrance listed below. So if you have underarm pigmentation and you're trying to tackle it, please switch to a fragrance-free, cleaner deodorant or antiperspirant, but make sure that it is free of baking soda if you're reacting to it. Alright. The fourth thing is pretty obvious, but if you notice the pigmentation of your arms is not just darkening, but you feel the skin in that area is thickened, or if you see any form of scaling, or if you feel itchy, there is a possibility that it could either be a fungal infection, a bacterial infection, or it could be, as I had explained before, acanthosis nigricans. So you should visit your healthcare provider and get treatment not only for the pigmentation or the skin changes that are taking place, but you'll also have to work on other things like lifestyle modifications or taking antifungal treatment, or whatever the underlying cause is will have to be taken care of. The next thing that I want you to take care of is minimize any form of friction that can occur with tight clothes. Now, people tend not to take this very seriously, but you won't believe that this kind of friction that is taking place on a repeated basis can again lead to that minor form of irritation, inflammation, and then post-inflammatory hyperpigmentation. So the areas where you will see this form of frictional hyperpigmentation is especially between the thighs and the underarm area. So if you're used to wearing tight fitting clothing all the time, it is good to wear something loose, airy and free. Especially if you're exercising, you're going to be moving your arms up and down quite a lot. Or if you're in an athletic sport where you are using your arms and legs quite often, then it is something worth considering. Now let's talk about certain topical creams that you can try applying to lighten the underarm darkening or the underarm hyperpigmentation, provided you have taken care of all the things that we mentioned before. So if you've taken care of the hair removal method, if you made sure there is no form of friction, you made sure that there is no underlying metabolic cause or a fungal or bacterial infection in that area, and you have switched to a fragrance-free, clean deodorant or antiperspirant, and you have stopped physically scrubbing or using any form of natural remedies, then coming to this point of applying certain topicals will be useful. But if you're going to jump directly to this point and expect magical results to take place, it's not going to be possible. The other thing that I want you to keep in mind is underarm hyperpigmentation, in my experience, is generally present since a period of many years. Alright, it's not come overnight. So the form of response you're going to expect from applying anything as well is going to take a period of 3 to 6 months to actually see effective, sustainable results. It's not going to be overnight. If you see it happening overnight, either your skin is brilliantly reactive to whatever you are using, or you should be doubtful about the way it is working. Okay. Now, it's not possible for me to name all the products. Like, there are so many out there. I'll try to list some of the most effective and good ones that I have found, in my opinion, and that is readily available over the counter, because I cannot tell you the prescription ones. But these are the ingredients that I want you to look for when you're searching out for any product that will aim and help in lightening any form of underarm hyperpigmentation. This includes niacinamide, vitamin C, especially tetrahexyldecyl ascorbic acid, because that is the form of vitamin C that works brilliantly even if you have sensitive skin. So again, there are many different forms of ascorbic acid, that is vitamin C, that is available in all forms of products today, and that is a whole topic in itself. But I want you to pay attention to this ingredient, especially if you're looking for taking care of your underarms, because this is a sensitive area. The other very good ingredients to look for are kojic acid, alpha-arbutin, and licorice root extract. Now, the way they work is some of them are anti-inflammatory, some of them are anti-tyrosinase. Now, that is an enzyme that is part of the pathway through which our pigment melanin is being formed. So if we are going to block melanin formation, we are going to in turn decrease the pigmentation that is going to take place. So that is the logic behind using these ingredients. And some of them are also chemical exfoliators, which will help to slough off the top layers of the skin cells. Remember, one of the reasons was also increase in the skin thickness. So if we can take care and in a controlled manner remove. Now, I'm not talking about using strong chemical peels. Please do not try doing that, even if you see any form of viral trend happening on social media. I've seen a lot of people come in with reflex hyperpigmentation and burns, and it is just not worth it. So you want to try these products at least for a period of 3 to 6 months, because one's skin cycle is of 28 days, and then it takes another 28 days for that top layer to actually fall off. So to see any form of good sustainable results over the skin and hair, it takes a long period of time. That is why people give up very quickly. But you have to be patient with skincare. It is really worth it. Trust me. So you try this for a period of 3 to 6 months, and if you still feel that it is not working for you, then definitely there are a lot of in-office procedures that your dermatologist will be able to guide you according to what is required and what is best for you. So you can definitely go in for a consult and get one. But in my experience, if you take care of all these things, you should be good for 90% of the time. Alrighty, I hope you found this video helpful. This is a very vast topic actually, but I've tried to give you the main gist and the main points for you to start working on. Definitely, you have your healthcare provider always to fall back on and get all the advice that you need. But I don't want you to resort solely on the internet or social media. And the reason why I'm saying this is because just recently I made a video on which are the natural remedies that you should really run away from or steer clear from using, especially when it comes to underarm pigmentation. So if you haven't gotten a chance to see it, you should check that out right now. Also, don't forget to let me know your thoughts, and feel free to share any products that have worked well for you or that you have experience with in the comments below. Again, there is no right or wrong. We are sharing what we have experience with. We always make educated and informed choices, and that is what I have been advocating for you right from the very beginning. As always, continue to glow, thrive and shine. Take care. I'll see you soon. Now it's not possible. Now it's not possible. Have you been wanting to start a good skincare regimen for yourself that is simple, effective and affordable? Then make sure to check this video right here.